Hi, it's Dr. Annette Mercatante. Caught me. Welcome back to Facebook Live, and we have our special guest. Amy, why don't you introduce yourself? Can you hear us?
Hi, I'm Amy Smith. I'm Assistant Division Director with Community Mental Health.
So we're going to want to emphasize a little bit today, obviously, mental health, because we know that is something that's going to become more and more important through this stressful times. You know, our focus obviously is number one, try and delay or avoid infection. If you do get infected, how to avoid infecting other people, but also the overall how to stay well regardless of the situation, and making sure that we find that silver lining, right? There's a silver lining in every cloud, and maybe it's a good time now to really kind of think about that. So we're going to start out first, as we usually do, with our statistics, our COVID statistics. Our daily totals, our cumulative totals are 3,296 cases with 73 deaths and a total of 235 hospitalized. But overall, and you notice the recovered is close to 1,400. And I will just say that with the difficulty we're having keeping up with everything, we've really been focused on investigating cases that are high risk, the priorities that we've discussed earlier. And one of the priorities is not taking cases out of the queue, calling them back, making sure they're recovered and getting them out. So that recovery piece is probably an underestimation of the number of people who've recovered. But in general, we have in the past 7 days, 750 new cases, which is about 100 cases per day, a little bit more than 100 new cases per day. And I'll emphasize again, these are the ones we know about. These are the testing that gets to us. For instance, the rapid antigen testing that's becoming available throughout the state is oftentimes not getting reported to us. So this is an underestimation of the new cases. And we have a 15.6% case positivity rate, which we've talked about before. The epidemiological slide, the graph, if you will, continues to show the steady increase in cases. You might consider the tip of that being a little bit flat, but we're going to obviously need a little more time to see if we can plateau and how long it might take to come back. And we are all hopeful that decreased social interactions prompted by the epidemic order that was released on Sunday will move this graph further into a plateau. Once we get into a situation we can manage, I think everything is going to be a little bit easier. Next slide is the testing capacity. As you can see, we continue to do a good job with testing. The total positive cases is starting to come up because our weekly averages for testing is coming up. And this is pretty consistent throughout the state. So I would say we still don't have quite as much testing as we'd like. Many people are still looking, particularly for rapid testing. And as this pandemic explodes throughout the Midwest and throughout our country, resources are once again becoming a little bit problematic, supplies for testing. So we're going to talk a little bit about that. We talk all the time about using our testing wisely, being smart about our testing so that it actually serves the purpose of keeping us out of trouble. And finally, our dashboard, please go to it. We're always trying to think of ways to provide this information regularly. In fact, I'm going to go right while we're doing the numbers. I want to go and please visit our website. We have some new forms on our website, both to submit your positivity if you test positive. It's really focused mostly for businesses and schools, but if you're an individual and you want to report your test as positive, please use that. You can submit it electronically. And the other form we have now on our website is a complaint form, and we urge people to use that. You can still call us with your complaint, but if you submit the complaint form with particularly even if you have a little evidence, you have something to support it, maybe a picture or something like that, that would be very helpful for us to move forward with cease and desist orders and other ways we can enforce compliance with the epidemic order from the state. So what we're going to do, I did want to talk about the testing because I brought it up. And one of the questions is, Oh, I forget now. Okay, let's go to the questions. All right. I'll start with it. I'm sorry. So, the first question is rapid testing is great. I work at a school and I'm home quarantined, and I was told it takes up to 7 days now for my results. And there's no question the confirmation testing, the molecular or PCR testing is taking longer. I would say an average of 3 to 4 days, but perhaps up to a week. And the person is saying, why so long? I'm sitting here. I'd like to get my results back sooner because sitting here alone, isolated all day, she wants to get to results so she can get back to work. I'm going to go over this again. I've gone over it a million times. But if you are quarantined because you have an exposure to a COVID individual, you've been exposed to the point where you've been told you should quarantine, that is a 14-day quarantine, regardless of testing. So if you get a positive test, then at least you know, okay, I'm positive now. I really have to isolate, and strict isolation then for 10 more days from wherever that test was. But if you're not symptomatic, you get a negative test, you still have to quarantine. And the negative test only means that you're negative at that point. So we're going to urge people to use this testing in a real reasonable way. And rushing off the first day you get exposed is probably not the best method. If you're going to get tested when you're asymptomatic, do it later on in your quarantine, in the middle of your quarantine or the latter part of your quarantine. It'll be more likely to be representative of what's going on. But remember, a negative test doesn't get you out of quarantine. All right. Do we have one for Amy? Let's get Amy started with her questions.
So we wanted to bring on Amy Smith today to talk about the pandemic community response team. And so we have some questions for her because mental health is huge right now, right, Amy? So could you tell us about the pandemic response team and what's that for and what's the purpose?
Sure, thank you. The pandemic response team is actually a modified response that we created working with the EOC, so that helping going to businesses, working with schools, hospitals, organizations, restaurants, business, any type of a business that is definitely affected by the pandemic, which is everybody at this point in time. When we created the team back in May, we were kind of hoping that the pandemic would be kind of wrapping up about this time. So we know that the pandemic is really affecting everybody now. So the pandemic response team is really intended to allow people the chance to talk about how it's affecting them at work, how their jobs may have changed, the responsibilities, working or not working, and then to help give them some tools to understand stress management and how it affects that, as well as self-care. The thing that we have learned by doing these pandemic responses is that there's a crossover between what's going on at work and what is happening at home. All the additional stresses, the teaching the kids either virtually, the hybrid model. I can't see my parents, and that's taking a toll on us. Right now, it's the holidays. What are we going to do? So we talk about all of that, and we see the commonality and help them to support each other in the work arena when we leave. So the response that we've gotten when we've done the pandemic responses has been very positive, and employees have been very thankful that we've come in and done it for them.
So how does somebody sign up to have the team come? Or is that?
And all they need to do is contact Community Mental Health or call Community Mental Health and ask for a pandemic response team. And it would be either myself or Adrienne Luckenbacher is who they would want to connect with.
Okay. So the 985-8900?
Yes.
That's the
Yep.
number?
Yeah.
Okay, thank you. All right, we'll go back and forth between your questions and docs today. All right, next question. Dr. Mercatante, this one's for you. You mentioned briefly about rapid tests, but are there any rapid tests being done in our area?
Sure. So we have a rapid antigen test. I believe actually a couple of healthcare offices have some rapid tests, and I know MedExpress has rapid tests. There is on our website a testing location thing you can look at, and you can find where your most rapid tests, where all the tests are, but where the rapid tests are. So rapid tests are available. They're not expanding too much, but we do have them.
And someone asked, how valid are they?
Well, now that we have widespread transmission, I think the likelihood of having a false positive is much lower. I think the bigger issue is false negatives because the test is not as reliable in the more asymptomatic phases. The rapid antigen test is best used when you have symptoms. When the majority of virus is shed is usually just before your symptoms start and a few days after with this COVID virus. So it's most reliable during that time. So again, using it when you're asymptomatic, it might be easy, but a negative test isn't really that helpful or reliable. You have to take the testing and also the circumstances under consideration. For instance, if you know you have an exposure to a COVID person and you develop symptoms that are very much like COVID-like symptoms, and you have a negative test, we would encourage you to continue to behave as though you have COVID. We would then go on and get a confirmatory molecular test if we have, if you're being evaluated by a healthcare provider. But I know a lot of people are just kind of figuring this out on their own. And so I just want to make it very clear that tests are one tool. They are not the end all and the do-all for this problem. It doesn't solve your problem by getting a positive or negative test. So you got to use your head with all of this.
Okay. All right. We're going to switch back to Amy for a question. Amy, if the pandemic response team that you talked about, if people aren't from a business or a facility, can they get any services that they might need one-on-one? Or how does that work?
Yes. I mean, if your business is not offering a pandemic response team, but you're interested in what other kind of resources are available, we have a wide variety of supports and services available through community mental health. We have a COVID hotline where if you want to talk to somebody individually, it's a text line, a phone line, or email. You'll be talking with counselors, licensed counselors with that. We have a lot of different activities that we offer that a person can engage in. There's, if someone's really struggling, we can also do groups, classes. We will do anything we can to help individuals and families and community groups to help weather through this pandemic. It's kind of an opportunity. Just because you're struggling doesn't mean that you have a severe mental illness. It means that you're normal and it's a normal reaction to an abnormal situation. We're not used to being isolated and told we can't go places or lockdown or wearing masks. So what we need to do is kind of figure out what we do have control over and how we can manage those situations. So our new tagline is kind of be kind to your mind. And so kind of helping you realize that so many people are struggling right now.
Okay. Thank you, Amy. Okay. Dr. Mercatante, question for you. Is the time frame for exposure still 15 minutes? I heard 20 minutes this week. Has it changed? And how long is it taking to get the results?
So that's kind of a mixed up question. So if you're talking about what is the guidelines we use for a significant COVID exposure, it is within 6 feet of an individual for a minimum of 15 minutes. And we also know that it can be a cumulative of 15 minutes over a 24-hour period. So if you're going back and forth and being near somebody 5 minutes at a time, but you do that several times over the course of the day, that can also be a high risk indicator. We know that if you're exercising, you can be even farther away from somebody and have a high risk exposure. We know that some types of medical procedures produce respiratory secretions, and that's a very high risk exposure. So you need really much less than 15 minutes would be of a concern. So it does vary, but I think for the average individual, it is still within 6 feet for 15 minutes. This isn't like you have a stopwatch and as soon as you get to, 14.3 seconds and you walk away, you're okay. It's not quite that straightforward, but it's a good guideline to keep. So if you're walking through a place and you walk by an individual who happens to have COVID, it's not likely that you're going to get infected by that individual, especially if you're both wearing masks, okay? But if you stop and chit chat and you take your masks off and then you decide to go have a glass of coffee together and then you find out they have COVID, it's a much greater risk. So it's a good guideline to follow. And the other part of the question, I think it had more to do with
how long is it taking to get results?
Get results. So I don't know if that means getting results for a test. As we discussed, The rapid test can be within 15 or 20 minutes. The molecular tests are now taking 3 days, 4 days, depending on how gummed up the labs get. But as far as how long it takes for your body to know it's got COVID, it's usually an average of from 2 to 14 days, okay? And the average time that you would start replicating enough virus to know that there's a problem, about halfway through that, 5 to 7 days. But only about half the people are sick at that midway point, which is why we say the full 14 days is important to stay quarantined, because you can still get sick on day 13. Still a fair percentage of people, it will take that long. So the duration of time that you have to be careful is the 14 days from the last exposure till the end.
Okay. We've had several hospital questions, so I'm going to get to those because there are several of those. So the first one is, do we know how our local hospitals are treating COVID patients and what kind of treatments are they using for the COVID patients?
They're using whatever treatments are best. So the basic treatments, there's anticoagulation now, that's very important, remdesivir and steroids, as well as a variety of oxygen support. They're absolutely delaying ventilation, which seems to be helping with our ventilator usage. And they are following the standard, what we know now. It may change over the time what we know to do, but they are following the best protocols available for hospitalization treatment.
Okay.
And I just want to say, let me go back to because we have Amy here, and I want to keep going back to the mental health piece, because one of the things we know our hospitals are doing now is restricting visitors. Again, trying to protect their workforce and trying to protect their patients that are there that don't have COVID. And if there is anything that's traumatizing to anyone, is having somebody they love in a hospital and not being able to see them. And this might be a great opportunity to, find those tools to talk to people remotely. It's not the same as touching them or being there. And I don't know, Amy, do you have any suggestions for people that have a loved one in a nursing home or a hospital now where they can't visit them or touch them? That's hard.
I think it's very, very hard. But I think what's important is find ways that you can connect. Can you email them? Can you text them? Can you have conversations at all with technology? And I'm not real technology savvy, but being able to just be connected as much as possible based on, their level of illness. And, there's a lot of people in the hospital that don't have COVID. So being able to still have that connectedness is really important. Schedule times to call them and have those conversations, if at all possible. Send them screenshots and pictures through the phone. It helps them and their spirit, as well as those who are stuck at home.
So going back to Amy's point of what you can control and what you can't control, obviously we often can't control when we get sick. Things happen to us, even if you do everything right. But you do have some control of how much risk you have getting COVID, especially if you are vulnerable and you're in that higher risk group. This is, there's a lot to consider.
There is. And I think, taking care of yourself and making sure that you are eating well and getting enough rest and being active is really important. Take your vitamins if you're like that, because you have to stay healthy to help support everybody else in your household. One thing that we oftentimes don't talk about is children and how they're reacting to this pandemic and how their lives are changed. I think it's really important for parents to have those conversations with their kids, sit down and talk about, what are you feeling today? What was it like doing school virtually? Setting them up in areas where they can do their homework and or classwork, so it's the same location and you have that structure, that routine.
Yeah, routine.
Break for lunches. Routine is really important for kids. They need that. But they also need the opportunity to get outside and to run around and burn off all of those endorphins that are flipping around in their heads right now. It's cold out. Put a coat on and dress them warmly to let them go out and play. I really think that is more important than, especially since they're on the screen so much more. Limit what you watch on the television. Stay away from the news and those kind of reports, or limit them at least.
And I think it's really important to admit that you don't feel okay, that everything's not okay.
Exactly.
They're not stupid.
Everything's not okay.
And everything's not okay. And children aren't stupid. They feel this. They are paying attention to it. So having honest conversations, and even with ourselves, admitting that we're feeling stressed and anxious and depressed. I mean, this is a grieving. We're grieving the loss of our normal lives, right? Remember the stages of grief. It's denial, anger, then you bargain, and then you get depressed, and then you accept it. Now we're a long way from accepting this, but the idea that we've got to talk about it and acknowledge the fact that the denial part is you got to get past that denial part and just start accepting the fact that this is hard and that you don't feel great. And I think that's a really powerful tool. Thank you.
And I think the other piece is being creative about how you're going to shift your thinking and shift your behavior so that you're focusing on more positives. What do you have control over? I have control over, what time I get up and what I'm wearing. So yeah, I'm working from home, but does that mean I'm in front of my computer in my pajamas? No, you get up, you take a shower, you do your hair. Yeah. but I mean, you still want to feel good. So there's nothing wrong with putting on a decent top, and maybe, comfortable pants. But again, it's because you respect yourself. You need to take your breaks. You need to build in some kind of self-care and what that looks like. So does that mean, hey, I'm going to take a long hot shower? Or does that mean I'm going to write in a journal? And does that mean I'm going to go out and exercise? Gyms may or may not be open, but what can I do? What other kind of exercise can I do so I'm still taking care of myself? Also with your kids, I think I've seen a lot more people out walking their dogs now, which is good, because that's healthy for you and it's pet therapy at the same time. So look at your schedule, look at your routine and be creative. Include the kids in what you can do differently. Have them help you make dinner. Now is a good time to teach your middle schoolers how to do laundry if they've never done laundry before. How to manage money. I mean, there's a lot of things that we can do that we can then take control over. We can't control that pandemic, but feeling depressed or feeling isolated, feeling frustrated, feeling anxious is very normal, but you also have some control over what you do when you get in feeling that way.
So let's
segue. Is the glass half empty or the glass half full?
Let's segue into the holidays, because with the 3-week order that's just been issued, it's going to be hard. So let's talk about number one, people feeling conflicted about maybe making the choice not to get together with their family. And then what are some other ideas they can do if they can't or they decide not to?
Well, this is hard. It's hard for every one of us, especially for those families that are blended and are used to getting multiple households together. And remember, we really are discouraging, doing holidays outside of your household. But if you do so, no more than one household. Here's a good rule. So if you know that your pod needs to be you and maybe your kids and their kids, your grandchildren. Okay. And you have to have a conversation with them to say, all right, before we get together, you're not going to be doing other things and we're not going to be doing other things. We're both going to stay in our homes as much as possible, not expose ourselves to multiple different groups, so that when we get together for the holidays, we know that we are bringing the minimum amount of risk back in. And, I've heard all kinds of things. And so you're going to miss out on this holiday. But remember, if you do the wrong things for this holiday, there may not be another holiday with your loved ones if they get sick and die. So it's worth the effort. And it's worth thinking ahead. If you've missed the Thanksgiving thing, think ahead for the holidays. Think about who your pod is, who your individual pod is. And if there's one more pod that you want to make sure that you have that connection with, that everybody understands the rules. And there's some great infographics on our website about what pods should and shouldn't do. I like the word pod. It's very organic, but you could call it a group or a cohort. But you want them less than 10 people. You want them all kind of in the same household. And you want everybody to understand the do's and don'ts of what they should be doing so that they don't go out and then bring something in. And again, I'm just going to emphasize, people, this is temporary. This is not going to be the way it is forever. We're going to get through this. We're going to start having vaccines. Just the nature of viruses, they do this. They'll wax up and they'll come down. It's just the nature of how viruses infect us. So getting through this holiday season is really important. It's going to end. We're going to get to the other side and be able to do next holiday season. I'm not promising, but I think it's going to be a lot different.
I think to kind of piggyback on that, Doctor, is that yes, the holidays for a lot of us are about traditions, but it's okay to do something different. And because you're not together as a big group or big family or having the big turkey dinner, that's okay. Find something you like and do something different, something a little more creative. If you don't know how to make turkeys, that's okay. Or you don't have the money because finances are short, then it's okay. You can make a pasta dinner. It's all about gratitude and doing something different because nothing has been normal for 2020. So let's say, hey, we're going to do something totally different for Thanksgiving too. And that's okay.
And
make it okay.
Right. The love is still there. The relationships are still there, even though you're showing them and expressing them a little differently. And I think that's what you got to remember. If you don't all get together, it doesn't mean you don't love each other. It doesn't mean you don't care. It means you got to do it a little differently this year. It's one way.
Write your loved ones a nice email and send it to them. So they've got something to open up on Thanksgiving Day and read it. You can do the Zoom calls. You can do a lot of different phone calls, whatever. But be safe. That's what's important. And again, what you have control over. And look at the big picture,
Okay. All right. We're going to segue back into some questions that we're getting to. Okay. People are asking, Doc, are you going to be issuing a stay-at-home order? And do you think, if you're not doing that, do you think that it's going to be extended past the 3 weeks from the state?
So I don't have any plans to issue orders in that are greater than what already exists. I mean, we already have restrictions in public activities. I think any of these approaches have to be at the very least regional and statewide, because if we do something in St. Clair County and our neighboring counties are doing something different, I don't think it has much impact at all. But we are going to do everything we can to enforce the public gathering restrictions. We take that very seriously. I think if people do that and follow the masking policies, we can really do a lot with that. And I think with that, I'd like to see some of these essential businesses continue to be able to function. I personally am very grateful that the YMCA is still open. I just want to say I'm really grateful that I can still go to that pool, even though they're not having group classes and things like that. So if we do this right, we can hopefully maintain some of these critical businesses and functions that we need as a society. So I guess that's an answer. So the stay-at-home order would suggest that we just shut everybody down, nobody can travel. And I think we can do this smarter. Instead of going at it with a hammer, I think we can really find that we can get a lot of purchase, we can get a lot of traction with just not gathering in crowds, not gathering in greater than 10 people. We can really do a lot with this. So that's our hope.
Well,
That's where we're going to go.
And taking off on that about when you said the YMCA, Community Mental Health is offering free yoga classes, virtual, for both children and one for adults. So go to our website and find out information about that. The cool thing is that all you do is see the instructor. You don't see anybody else in the class, and nobody else can see you. So they're open to the public. You know, again, if your gym isn't open or you can't go for safety reasons, there's other options out there.
There's a silver lining. You can exercise in a virtual group and people don't have to see you. I love that.
Exactly. It doesn't matter how you're dressed.
Okay, well, it's already 4:00, so we're going to go on for a little bit longer because we've got a lot of questions that aren't
we missed
answered.
a lot of questions, but I thought it was important to really talk about mental health approach as well. So, and remember that you can always post your questions and send them to us, and we'll continue to try and answer them directly by writing or sending them back. So,
okay, so let's answer some hospital questions. One question was, how many total inpatient beds are there at all 3 hospitals in our county?
280, but believe me, that's not a static number. That number can go up and down dramatically based on staffing. And I think really one of the things statewide that's more challenging as opposed to just physical beds is the staffing capacity. So you can't bring people in if you don't have anyone to take care of them. And the other is that all of our hospitals have pandemic plans where they can rapidly expand their bed capacity as well. So 280 is a rough number, but please don't consider that a finite number. It can be up or down.
Okay. The next question was, will you still be unveiling a new map for positive cases and zip codes? And when will you provide it?
We're going to have it out tomorrow in addition to the normal map. And that will give us proportional cases in regions so you can see a little bit. And those would be cases just in the last 14 days. We'll do so it'll be the last, we'll just take the past 14 days and we'll take those cases that we know about. Because I can tell you some areas of the county probably don't do as much testing as others, partly because it's not available. But so we'll take the number of active cases, the cases that we know about, and we'll put it in proportion to the population. So you can see not just the raw numbers, but what that means as a result of how many people live in the area.
Okay.
And available tomorrow.
The next person asked, how does the number of people in our hospitals compare with how it was in March and April?
Pretty close. I would say we're pretty much where we were in March when we had our first stay-at-home order and we were starting to worry. So it's pretty close.
Okay. If you've already had COVID and recovered and come in contact with it again, can you pass it to someone else without becoming sick again?
We're not exactly 100% sure. In general, we're saying that if you've had COVID in the last 90 days, you can safely assume that any exposure you have, you would need to continue to quarantine. We're assuming that you have about 3 months, 90 days worth of immunity. It's not 100% guaranteed. No one's for sure. And I would just suggest that if you get sick during that 90 days, that you still get tested. But we are using that 90-day criteria. And I'm sure there's going to be further data on that. I think the vaccine is going to provide perhaps more information on the duration of immunity, because we're going to be able to check that a little bit better. And we do know that people can get reinfected, but almost all of them have been outside of that 90-day window.
Speaking of vaccines, somebody has a question. Once a vaccine is available, can you speak to the issue from the point of receiving COVID-19 vaccination? How long is it for a person to have full immunity?
As a result of the vaccine, how long can a person expect immunity as a result of the vaccine? We don't know.
Okay.
They haven't been studied that long. We're assuming that it'll be at least, we're hoping it'll be at least 3 to 6 months. Hopefully longer. We're thinking 6 months to a year would be a great outcome. It could end up being even longer immunity that we just don't know yet.
So do they anticipate it being like a flu vaccine, like a yearly vaccine?
Possibly.
Don't know yet.
Can't answer that. We don't know. We haven't had the vaccine out long enough. It's just it hasn't been studied, so you can't really comment on something you don't know.
Right.
Okay.
This person has seen a video floating around about wiping your groceries down with a disinfectant when you bring them in your house. Is this still necessary or helpful?
No, I don't think we do recommend wiping everything down. I mean, at the beginning of this pandemic, when we knew that the virus could be transmitted and how long it can sit on a surface, we certainly, we went to all those lengths about wearing gloves. But I don't think you have to wipe everything down that comes in the grocery. Remember, if it just sits in your closet in your car for several hours, it's more than likely not going to be contagious. Here's what I do. I would go ahead and do your groceries the way you normally do, and then wash your hands really well. That's what I would do. And make sure that you then wipe off common surfaces or frequently touched surfaces at the end, maybe the tables. But I wouldn't wipe every single, grocery product down, no.
Okay. This next question was, have nasal swabs been shortened to use with the new protocol? I've heard that swabbing is now both nostrils and not as deep.
Okay, well, that goes to the different kinds of tests we have. And so the molecular tests called the PCRs, they are still done primarily nasopharyngeal. Those are probably the best specimens you're going to get, but you can run those tests with an anterior nasal swab. And if you're doing an anterior nasal swab, the appropriate protocol is several turns. I think we do 5 turns on each side. Okay, so that's how we do it. Now they're going to be coming out with other tests, maybe some saliva tests, other types of tests, and but they're all going to be involving checking your respiratory secretions of some kind. So anterior nasal swab. And the other reason anterior nasal swabs are a little easier is because, number one, they're not as icky. Okay, you don't need a trained professional to do it. Anybody can take a little swab and twirl it around your nose, and it really reduces the need to have all this PPE. When somebody's putting something way back, it makes you sneeze, it makes you cough, and that increases the risk of exposure to whoever's collecting the specimen, the healthcare worker or whatever. So the anterior nasals, I think, is becoming more of a collection of choice, just because it can be done more rapidly and with a broader range of healthcare providers and support staff without as much PPE.
Okay, we have 2 more questions, and then we'll do closing comments from you and Amy. Can you speak to the long-term effects of those who have COVID-19?
Not exactly, other than we do know that symptoms can continue well beyond the infectious period. So people think about infection, and that's not the same as illness. The infectious period, like I mentioned, the time that you shed this virus is about 2 days before the onset of your symptoms, probably a couple, 2-3 days after. But people, as you know, remain ill much longer than that. This is not a 1-week infection. People generally start out milder as viral infections go, and then they actually get sicker as time goes by. And this is because of the unique way the virus affects our system, our body system. We don't know a lot about it, the details about that, but we also know that some people a month later, even longer, are still just having trouble, like fatigue, and sometimes even more serious trouble. The real long haulers, I think, are rare. I can't really tell you how often that is happening, but clearly people are not feeling better in a week. People are feeling kind of crummy for several weeks, if not longer.
Okay. This question just came in. Do you as a physician feel comfortable giving this vaccine to a patient, not knowing the long-term side effects?
That's a great question. And the answer is I'm going to wait and see what the data shows. We still have not seen all the data. As soon as the emergency use authorization goes through the FDA, the American Committee on Immunization Practices, the ACIP, does meet. I think their emergency meeting is Monday, to be honest with you. This is a group of 15 individuals, professional, expert people who are not government and who are not pharma. And they review every piece of data and information about all of our vaccines, and they update our recommendations for vaccines. So this group, who I highly respect and know way more than I do, more than I will ever know about vaccines, is going to review all the information that they receive for each vaccine, and they are going to issue recommendations. If they issue recommendations that they believe this vaccine has benefits and that the risks are small, then yes, I would be happy to receive it myself. I'd be happy to give it to my own family, especially when you weigh that against the risks of what this virus is doing to us as a community. The thing to remember is that we will only have about 2 months of clinical trial safety data. And yet that 2 months time is generally more than enough time to identify any serious risks. Those really rare risks for all vaccines have to be assessed after millions of vaccines are given. And the good news is all of the safety protocols that we have in place for vaccines, both pre-production, during production, and post-production, they are all in place. We have 3 completely separate safety monitoring systems in place after a vaccine starts getting used. They are all real time. In other words, if there is a signal that there's a problem, we are going to know about it very quickly. And these systems work and they're fully functional. So, we can talk. In fact, we'll be putting that talking point out. So we're putting that together now, what these systems are called and how they function. But anything's part of the vaccine can have some unexpected issues. We know that, but I do trust the system will identify it quickly, and I do trust the system of development. Remember now, this vaccine was each one of them has at least 30 to 60,000 people that it's been tested on. That's more than enough to really identify any serious problems. So we're going to follow that and watch that carefully. Remember, when the vaccine first rolls out, we're going to start providing it to the people who need it most, who are at highest risk. And then as things go along, we will expand that audience more. And also remember, there are over 100 vaccines that are in production right now. So each vaccine has to be addressed separately when it comes to its benefit risk profile. So the answer is a little more complicated than I'd like it to be, but believe me, we're going to be watching this very carefully. And I won't lie to you. If it looks like the vaccine isn't what we expected, or if it doesn't have the type of safety information that we need to feel confident, we will tell you that as well.
Okay, last question, then we'll do closing comments. Someone wonders, why are the plants still open when the spread is much greater there than at a bar or restaurant? Why do you think they made that decision?
Well, I don't know that that's true, that manufacturing plants have much greater transmission rates. The outbreaks are everywhere. And actually what we found is a lot of our manufacturing plants and our larger businesses have very strict COVID protocols and do a very, very good job of maintaining a distance and protocols that keep the infections under control. Restaurants, it's all over the board. And I think one of the reasons that the state kind of focused on bars and restaurants is because they knew that a lot of people were going there and not really paying attention to distancing requirements and masking requirements. And let's face it, when you go to a bar or restaurant, you can't wear a mask, and that's the other issue. So one of the most important tools we have can't be used in that environment. And I think the data also supports that you have a greater risk. Most average people have a greater risk of getting infections when they go out to a bar or restaurant. The other thing I think you got to consider is the economy. We do need to work, and we don't want everybody to just suddenly lose their jobs because things are shuttering down. We do need to work, and so we have to find that fine line between keeping people employed and trying to manage the transmission of this virus.
Okay. So let's have closing comments. Amy, do you want to go first? Thank you for being on, by the way. You're very helpful today.
Well, thank you. Sure. Yes, I think from a mental health standpoint, this COVID pandemic has definitely had a horrific effect on all of us. So a couple things to kind of keep in mind are, watch yourself, watch your family members. Are there massive changes in your behavior, in your moods, in where you're at emotionally? Are you struggling with any kind of thoughts? If so, definitely reach out for help. I think we're all COVID fatigued, but let's start changing the way we think about it to what do I have control over and what can I do to keep myself and my family safe? And be creative, try new things, stay positive as much as possible. I kind of look at it as a three-legged stool. You need to take care of yourself and make sure that yourself is healthy, both mentally and physically. You need to stay focused on your family and what it needs to take to make them healthy. And then you also have to have some kind of outlet, some kind of activity, some kind of hobbies or interest, things that you can do, teaching yourself some new skills. Use the web, Pinterest and other resources. Also, if you need, speaking of resources, our community services collaborative body has a website with all kinds of resources that are available related to COVID. So that web address is cscbinfo.org. You've got Community Mental Health's website. They have all kinds of information and activities and free classes and opportunities and trainings that people can, inquire about. And if you don't see it, send us a message. We will get back with you. And maybe you have a good idea and we can start something new. As well as the health department has all kinds of resources. So you're not alone. We're all in this together. So, just try to be as positive about it as you can. That's what's going to make this easier for you to tolerate.
Thank you, Amy. Doc, we also mentioned about the holiday schedule one last time.
Oh, thank you. Yeah, so let's do that before I forget. So given the holidays, we still want to do this on a weekly basis. So starting next week, we'll be on Tuesdays at 3:30. And we're going to continue the Tuesday schedule all through November, the rest of November and December. And we'll go back to Thursdays in January after all the holidays are over, because all the holidays fall on Thursdays this year. So we'll do Tuesdays starting next week. So look for us then. And then just to follow up on Amy's comment, all I can say is, I think the hardest part, unfortunately, is kind of ahead of us right now when it comes to the pandemic. But we're better at it now. We know more. There is definitely some light at the end of the tunnel. We have therapeutics coming down, and the vaccines are turning out way better than we even hoped for. So there's a lot of reason to be hopeful. So we just really have to get through this next difficult part. And I think that's easier when you know that there's something on the other side that's going to be easier. And all I can say is don't be so hard on yourself. It's okay. It's okay not to feel great. And maybe the bar shouldn't be, I want to spring up out of my bed every day and, rah, rah. Maybe it's just, I want to get up every day and make sure that I eat right and I get out away from my computer, Put your phone down. I'm sorry, I know social media is great. We're looking here. But, sometimes that information overload is just too much. Put it down and walk away. Just do those things, as Amy said, that self-care that can just bring you down a notch or two. You may not be able to feel great, but at least you don't have to feel as bad. And reach out to other human beings. Reach out to the people you love. And the more you can help, the better I think everyone's going to feel. I think it'll make you feel better too. So thank you, everybody. And I really appreciate you joining us today. Hope to see you next week.